but rather this is to disperse some, bring clarity, bring focus to whatever you have been doing so far, to reiterate, reinforce that whatever we have been doing so far is actually also correct because there are proofs now, which I will be showing you in a while. I will be talking about what we have been doing so far, how accurate it has been, what you will be doing in the coming 7 weeks that are remaining for the exam. What is the plan? 6 weeks rather, that we will be doing in these coming 6 weeks for the September exam. And the March candidates, I will be talking about how you're also on the right path and what you will be also doing for the March preparation. Right? So give me big yeses if everybody here is open to receive clarity, disperse the confusion, and actually get confidence and get affirmations and reinforcements about the approach that we have been following so far. Because we cannot move forward with confusions, we cannot move forward with doubts. At Winspert, I do not prepare you like that. You all know that. If you have watched any of my classes since the beginning, all the motivation classes that we do, all the internal classes that we do, when I prepare you, when I see your fears every week, when I see how confused you are when you join me, and when I see the clarity and the confidence that you have when you go for the exam. So I see your journey from day one to the day before the exam. And I've not seen just one journey, I've seen multiple journeys since 2017 when I started this program. So I've seen enough number of students move from point A to point B with confidence. It is recreatable, it is absolutely achievable, and there is scientific evidence behind it. It is not wishful thinking, it is not something that we desire and we work on. It is something we have timely tested, proven, and worked. So we have hacked that system. That system is already hacked, and the proof I'm going to tell you is in the pudding itself. Everybody saw the release papers. If you're enrolled with me, you took all the sample papers, right? So did I, so did my team. We all sat together. We took days to come back with this plan. We did not jump on conclusions. We did not disperse panic. We did not come on the groups and showed you, oh, this will happen, that will happen. Everybody was calm. Everybody was how they're supposed to be, right? The calmness and clarity will take you towards your goal, not confusions, not creating panics, not trying to, utilize this as an opportunity to create a following and try to be some guru and, predict. I'm not making any claims. I will show you the proof. I'll show you the approach from the past trends. Nobody can actually predict future. It's up to on ADC's hands, and which is fairly there is, right? Margie, welcome to the program, welcome to the lectures. Today I'm going to be talking about how the ADC pattern really works, how we can prove that what we have been doing is absolutely accurate, which will increase your confidence in the program and the preparation method. Number one learning point is that you don't have to change any path. One thing that you have to know before I've even finished and conclude the lecture is that you're on the right path. You are ahead on the curve as always. And what claims I actually make is that I keep you ahead of the curve. That I know. I lead because I know I'm teaching you ahead of the concepts that get asked. I don't chase the concepts or the questions. I don't make my students just mug up the questions. I have never been chasing that approach. I always prepare, and not today, not before September exam or March 21 exam. From 2017, this has been the approach when none of the program was doing the Odell cases. None of the program was actually giving you explanations of the answers during the live lectures, every single TG classes, everything. This is not an approach of today. This is approach which is the foundation of Winspert. So I didn't have to panic. I didn't have to worry or go crazy finding resources, what new can come, because we have been doing that approach from day one. And as my students, as my kids, when I talk about you, I know I use the term you're my kids, right? So when my students and my kids are working on something, it is my responsibility from day one to prepare them for the best and not wait for the storms like these, right? So, first of all, I want you all to know, be confident, and be assured that you're on the right path. Now, number one thing is that the new questions are released, and there were 200 questions on those files, right? Everybody took the file, took the questions. There were 200 questions in the file. Out of those 200 questions, all the answers, majority, up to 97% answers, matched our ultimate advanced file answers that you took, and you brought me the results. You brought me the scores. I have so many WhatsApp messages, so many WhatsApp screenshots that I would love to share with you all, but you know it, you have posted on groups, you have sent me personally, that how many of those answers absolutely matched. That's your number one proud moment, confidence taking away that our approach, our reference finding method, our guidelines are directly aligned with ADC standards. And you know, everything, every concept will have all the contradictory references. For example, even if you take a pregnancy mouthwash recommendation, there's a reference for fluoride also. There's a reference for bicarbonate as well. There's a reference for, rinse with water, consume milk also. You will find reference for all the possible options. You just have to search on Google, and whatever you're searching for, you will find a reference for that. Is that correct? But still, we were 97% in the confusions, in the plethora of all the references, were able to find the ones which accurately matches the ADC answer keys. That goes out to show that the hard work that you put in, the research that goes in, when I prepare for a lecture and I spend 5 to 6 hours finding those references, it really makes the difference. And that's what makes the difference. That is exactly brings you to the examination center with the correct references, with the correct answers, and then it translates to the grades. Making any false claims, and people can blame you for anything, they can go ahead and do that because they don't really have something worthwhile to do with their life, so they can come back on Facebook, troll, complain, whine. But the hard work that goes into teaching, the hard work that goes into educating requires 6 hours. So I don't even have time to respond back to the trolls because I'm really digging into 10 references for one question to find the one that matches the ADC keys, right? So that's my job. And that's I really take very seriously. And today, when we analyze the number one, when the sample paper were released, I was not worried about anything. What will happen? What will come? Nothing. First thing that came into my mind was, let's check the answers. Are we there with ADC standards or not? And it was to my I did till the time we did not cross check each and every answer with our ultimate advanced file, I had no peace. I had zero peace because I wanted to see that whatever I have been training my students for, whatever I've been training my kids for, are they even going accurately to the examination center and getting it right? That was my number one priority that day, that our approach, that our notes, that the material, the curriculum that I'm so proud of, that I've built over last 10 years, almost a decade almost, is worthwhile or not. That day, that moment was my test. And when we got 97% accurate match, then I could smile the first time on that day. And I'm not lying when I say that. And I'm not lying. The first smile of that day came on my face when I saw my result on the sample test. So number one thing is that be thankful for this test because it gave you the confidence. It gave me the confidence that the approach, the research, the CV classes, the special topic classes, the important article classes, all those article classes, all those classes I had been made fun of. Oh, she reads the articles. Oh, she just comes and reads the articles. Because those are your research material. Those are your actual recommendations to apply to the patients. So yes, when people laugh at you, please know you're doing something worthwhile. So keep doing that more. That's an actual social proof that you're doing something right. And we got that proof. Now, what we did after getting the accuracy, we tried to see the highlight themes of the sample paper questions. Now, the theme of sample paper questions were still the infection, the investigation cluster, the information gathering cluster, diagnosis cluster, treatment evaluation cluster, all those professionalism, health promotion cluster. The basic theme was still the core dentistry, the differential diagnosis, for example, periodontal versus periapical. These are certain examples I'm giving here. These were some specific themes, right? Then the pharmacological therapeutics questions were asked, oral lesions were asked, sterilization protocol were asked, radiographic questions were asked, pediatric dentistry, preventive, we have been focusing so much on preventive, right? Prosthodontics, and then other subjects in perio. For example, I brought here certain examples for you to see that those questions and core concepts were asked. Now, the clarification here which comes is that ADC has mentioned that these exact questions will not be repeated. But it doesn't go to say that the core concepts of these dentistry, all these disciplines will not be asked. Well, on the ADC handbook, cardiology is one of the major disciplines. The percentage is dispersed. So you think if there are questions on meth user, if there are questions on any other high caries risk, you think if that question is not asked, then all the caries question will not be asked? Do you think that the core concepts will be eliminated? Do you believe that? Anyone here who believes in that? No, right? None, right? The core dentistry will be the foundation of the ADC Part 1 exam. And these questions may not be there, but their variations, the core concept around it will be there. If you have watched my class, when we do any question, tell me, do I ever make you memorize an answer? Do I ever focus in my internal classes? Do we ever do it like that? No, we do the rash technique. We do the variations. We talk about multiple histories. We talk about if this was not there, then what will we do? You eat up my brain on the comment section, right? Ma'am, what if this was not there? What if that was not there? You all see that, you all witness that on chat in every internal class. And that's when you leave the session fully gratified. When I have taken every single possible scenario that plays in your head when we read that question. So we use that question actually as a kind of like a scaffold and then build around it our concept. It's called a retrospective study. If I just make you do only concepts and keep talking about it without putting it on a practical use to a question, it would get boring or it would be maybe dry and volatile and will not stick with you. Is that right? What we do is we take the question as a scaffold and we build the concept around it and then see how in the exam it can go. And that is called as a retrospective studying method. I've taken my AFK exams, I've taken my ADC Part 1 exams, I cracked both the exams. And the only method I did when I prepared for both the exams, both Canadian and Australian, the approach that I've always followed was retrospective studying method. Retrospective doesn't mean that you have to just do the questions and memorize them. No. Retrospective is far more deeper. You start with the question, you understand that, and then you build more concepts around it so that if in the exam other questions related to the same core concept come, you can still answer them 100% confidently. Making sense so far? Everybody's with me on this, right? So most important takeaway point is the core topics will still remain essential. The form of the questions can change, the histories can change, but the themes will not become obsolete. They are the ADC handbook core disciplines. Now I have divided now in basic whole syllabus, there are going to be core topics and the recent topics. Recent topics mean recent priority in Australia, recent priority in dentistry throughout the world, recent changes in dentistry throughout the world, which is specifically applied in Australia, then recent dentistry protocols and guidelines which are released, focus points in Australia. But the core topics and recent topics will be combined. Investigation. See, no matter what you do with the asylum seekers, no matter what you do with indigenous, your investigations and information gathering cluster questions will not go on asylum seekers, will not become different, will they? Only contemporary and recent topics with certain special groups will affect the professionalism and health promotion cluster with certain professional guidelines changing for them, and which we are already doing the latest policies. You're taking quizzes on the latest policies every single day on our WhatsApp group. Are you or are you not? You're revising every policy on a regular basis on WhatsApp quizzes. All the latest professional policies, you're doing them. So both, and then there are certain core topics which also become evolved. So core topics like erosion, for example, Carey's recommendation, for example, endoperio combined lesions, for example, crack, vertical root fracture, they are getting recent guidelines, systematic reviews. Are they or are they not? And did we cover that or not? So even the core topics can become recent with new guidelines being released. Australian endodontic guidelines got released 2024. We covered it in our public session few months back when nobody brought you that. We did that before March exam, right? So what is now remaining from the sample papers is, after analyzing those 200 questions, we found that 27 questions out of those 200 were only the ones that were not present in the ultimate advanced file. Yes? You want to know the plan of action for these questions? Yes, everybody's been asking me that now, right? So we have 27 new questions on the file, sample release papers, which we will cover. Not because they're not going to be coming, but because they are the core concepts. And if we don't prepare them, how you will take variations on them and confidently answer them? So do we need to do them or not? Tell me, yes or no. The 27 new questions which were not there in the advanced file, we'll cover them. We'll talk about variations. We'll prepare the core concept around them. There were 12 questions where the answers were varying because there were slight variations. So the match that did not happen because of, in most cases, variations, only 12 questions. So where the match was not happening, that is because of certain variations. In all of those 12 also, in some there were certain variations. Yes, there were some outright corrections, but out of 12, some of them were also even variations or just one word missing. No, 27 question means actually, Dara, just 27 individual questions. They are not 5 scenarios. There are varied scenarios, but in one scenario, maybe one question was new, one was missing, right? So total 27 questions. I'm going to show you the file, just wait. And the 12 questions where the variations will be discussed, the references would be updated. So new references are going to be added. I'm going to add the feedbacks, the explanation and the references as well. And they are going to be also put up on the app as a separate mock, as a new ADC sample paper practice mock. Because these rest of the questions you have as an ultimate advanced file assessment mock already, right? Everybody knows that. So we are going to take these 39 questions and even focus and do them. Margie, if you're enrolled, then we have this file, right? Now, I've created this file. It has all those 39 questions. Dara, can you see here? So there are not individual SBQs. If individually, I'd say there are 18 SBQs. So individually, Dara, there are 18 SBQs, out of which maybe most were there, but one or few were missing in Ultimate Advanced File. So we're adding there. See there? And now the 12, which were also the variations, we have put it there, right? Now what we are going to do is we are going to add this to our existing database and add it to the Ultimate Advanced File Volume 2 file. So we'll combine it. Yeah, these are the new scenarios, Dara. That's exactly what I've been saying. Some may be new, some may be older ones, but these questions are new. 27 are new questions. Okay. After that, we are going to be doing, once we complete our Ultimate Advanced File Volume 2 classes on August 2, after that, in 3 more classes, I will finish these extra questions as well. 39 questions, I will cover them. No, Navneet, that will happen. Remember August 2nd, we finish our Ultimate Advanced File Volume 2, right? So after that, I'm going to take 3 more classes and finish these 39 questions as well in our internal classes, Navneet. They will be part of our internal classes. So that's the action plan. Add them to the Ultimate Advanced File Volume 2, cover that after 2nd August when we finish the Ultimate Advanced File Volume 2 till whatever we have now, and do the extra questions after them in 3 classes. Yes, Dara, as you told me, I've planned to add it to the UF too. Coming to that, then they will also be added as a separate mock on the app, right? They will also be added as a separate mock on the app. Is that correct? So you can practice those again because they're not in the Ultimate Advanced File quizzes. Or I will add them as a UF Volume 2 quizzes or as a separate mock, but they will also be added to the app as a practice mock. Now, this is the current approach, understanding and learning from the sample paper, what we are going to do, right? Coming to everything, Preeti, hold on. I'm going to give you the full roadmap today. You will not leave this session without clarity. Now, let's see. What about the core topics, but what about the recent topics? Okay, let's talk about that. Everybody is now creating panic. Everybody's trying to get opportunities out of that panic. There's no opportunity in that. It's a simple something which was pre-existing. People trying to make something new out of it is because they didn't even know that this has been going on at Winspert from a long time. This is not what we have been waiting for. I learned this lesson very hard way in March 21, that anytime anything new can come. My research should not stop at bringing the references to the existing concepts that have been asked. My research has to be for the newer concepts which may get asked as well. So going back to September 24 and March 25, the trend that we can study and learn from. September 24, 90% of the paper was new. Anyone here who has witnessed that time knows it. Many of you were there and with me on that September batch as well. All right, Shivani, I'll add that as a separate mock. September 24 was 90% new and the pass rates were bleak. Yet we got 70 candidates cleared through our program when none other academies had even 5 or 10 making it through. Why? Because we had hot notes, we had power notes for our students to prepare much ahead of the curve. Did we struggle with the September 24 pass results? No, because out of the pass rates, we were the max. Why? Because even with the 90% new questions, there were core concepts still, but the new questions around them, and there were recent topics as well, so new questions around them. Whether there were core concepts or there were recent topics, both had new questions around them. Is that right? Everybody who took the September 24, this was the pattern. There were new questions, unfamiliar histories, unfamiliar way of asking questions, but the core concepts were still there. The cracks were still there, the vertical root fractures were still there, erosion was still there, perioendo combined lesion was still there, the core dentistry was still there, and then the recent topics were there, right? Indigenous populations, more recent, policies were there. Definitely recent combinations were also there. But we had already 30, 40 policies in place to even prepare for the recent topics. Everybody at that moment realized when we had the success celebration class with the September candidates, they all reiterated how important was to do those hot notes and health promotional policies. Everybody suddenly realized the relevance of the subject wise article folder that we had, right? All those articles and all that research material immediately started making sense to everybody, and people who had been already doing it got it successfully out in September 24, even with the 90% newest exam. Come to March 25, still up to 60 to 70% were new, right? Even March wasn't easy. March did not just suddenly copy pasted everything from September 24. No, they were still challenging you, they were still testing you, and they will continue to moving forward, and they should, because they deserve the highest quality dentists in their country. Absolutely. So 60 to 70% new questions were there in March 25 as well. Again, but the blend of core concepts and recent topics. One suture, two suture questions came, and everybody starts going about the recent topics, and you forget about the core concepts. Do you think one suture question gives you all 4 A's? Or do you think your core dentistry that you prepare with the recent guidelines, the VRF, the cracks, what are the recent guidelines around them? When there are 5, 6 questions per topic, trauma guidelines, trauma injuries, even the endodontic considerations for traumatic injuries has updated now as per ADJ. And I'm going to cover that in the coming classes. You know it, I've put it as the hot note as well, right? So the changes can come. We prepare the hot notes for them, we conduct classes on them, and then the exam gives those questions. So it's not just one suture question that defines your future in ADC exam. It is your traumatic injuries, the entire preventive pediatric model, understanding prosto and recent implant concepts that we did an entire series on, the medical emergency series on, the series of the core concepts that we have been doing, where at least per topic 10 questions come. They are your defining moments. Yes, recent topics matter. Of course, they are cherry on the cake if you get everything prepared, but everything matters. Again, in the March also, this is the trend that the new concepts, core concepts, updated recent topics, all are getting asked, and the percentage of the new questions can change. So forget about the 60 to 70% new questions, or forget about 90% new questions. Focus on preparing the core concepts and the most recent topics. This is your focus here. This is the focus. Anything that comes in the exam is beyond your control and should be. But how you prepare for that is with your control. Is that right or wrong? Now, as you know, even with the hot notes, we are not stopping. In this batch also, with every Ultimate Advanced File Volume 2 session, I write down all the new concepts. I study from the ADJ, all the latest ADJ volumes, all the new concepts, sleep apnea, sleep medicine, sleep bruxism, everything that's showing up. We are creating classes on them. We are creating hot notes on them. We are creating material and quizzes on them. All the latest policies that I gave you, 40 policies, I created 2 mocks for you on them. Everything, anytime something new comes up, we give you practice tests, we give you notes to study, we give you questions to practice, and we give you classes to learn and understand them. If you have been attending my public sessions in the last, maybe from September 24, we have done all the latest guidelines already. What people are now predicting, oh, this new will come, that new will come. We have been doing it from last 1 year almost. All the latest guidelines on internal bleaching, geriatric residential care people, children with disabilities, endodontic guidelines, which were latest cracked teeth guidelines, latest VRF guidelines, endoperio combined lesions, all the latest implant articles. Then calcium silicate and indications of your RCT in the traumatic injuries, which we are going. I just gave you the recent hot notes on that, and I'm going to have session on that. Sleep apnea, sleep medicine, right? High risk populations, pregnancy and smoking, which we did a few weeks ago. All those are the examples of the newest core concepts, recent topics, everything combined, right? We have already been doing that. So, well, first of all, you need to know that you have already been doing, which I love to call, is a Winspert holistic hybrid approach. You're already working like that. I make you work on thousands and past papers, and I give you the most recent guidelines. I am the most old school, I'm the most contemporary soul you'd find working for you together, right? So and then I showed you the thousands and past paper questions which are getting repeated in the exam as new questions, right? So even the thousands and past papers are making their way back in the exam. Why? Because the core dentistry is still not going to change. The core topics will still remain relevant till dentistry is relevant or till that technique is being done clinically, right? So the core topics you're fully prepared and working on, and you have mastered also, I would say, every day on WhatsApp, I test you on questions, the policies, the guidelines, your tutor support classes, every week, every single day. The amount of knowledge that you're gaining, the practice that you're doing is strengthening your core topics. So one old school approach that we are doing is doing the hot notes, the power notes, ultimate advanced file volume 1 and 2, mega master file, CV classes, special topic classes, and you have more than 50 app based mocks. Tell me if I'm not wrong. I think we would have more if you count all the MMF quizzes, if you count all the ultimate advanced file quizzes, and the cluster quizzes. I think we have maybe 60, 70 mocks now, maybe more. I have stopped counting it. That's how the number has gone high. Isn't that right? Give me yes or no's because you guys can tell me more about that. You see that every day. I think we have much more mocks than 50 or 60 now. Now that's your core preparation. But at Winspert, we do the complete holistic hybrid approach. That's why we also are simultaneously doing already the recent topics, not waiting for the samples to be released, not waiting for this as some aha moment in dentistry or ADC. No, this is no aha moment. We have been doing and having our aha moments since many years. When we find new guidelines, when we search for Australian endodontic guidelines released, when we find new internal bleaching articles, every time we go back and find new articles, we get those aha moments. Do we or do we not? Every single time I show you a reference, your mind gets blown off. Every power session we prepare on a new series, your mind gets blown off with that knowledge. You go back smiling and message me that how confident you feel after class. Those are our aha moments. And that's the new era that we have been building from all these years. There is no one point in time that greatness or something extremely excellent happens. You have to create greatness. You have to work on excellence with years and hours and weeks and months of hard work. Every single day, you have to keep working hard. And then over years, you create greatness. And then over years, you achieve excellence. It doesn't happen overnight. Doesn't. Looks like it's overnight. It doesn't, but. So the recent topics are now, now what we had already done, even before the sample paper came, I have already collected 70 new policies which are relevant for ADC, ADA policies. So we already have 30, 40 policies. We have 70 new policies, which I will not make you read entirely, but I will summarize it. So this goes on for the March candidates, right? Gifty, I'm talking about March candidates again. We are bringing, as we brought the power notes, as we brought the hot notes, we are now bringing the pioneer notes, which will be the accumulation of the newest advances, newest policies, newest updates, most contemporary Australian trends, which will be called the pioneer notes. I'll start creating them. I've accumulated 70 new policies and then more fact sheets and articles from the Australian resources, but I'll not make you read them all. So just like your hot notes are summaries of the latest core guidelines, pioneer notes will be Afira about that, about those 70 new policies. In a week, I'm going to study them. And whatever is the most crucial for the September, I will give you a short summary for that also, Afira. Okay, so even if not in a designed manner as pioneer notes, I'll try to give you something practically by maybe August mid so that you have at least 2 weeks to review them. Okay, practically speaking, it will require that much time and understanding because I don't like to do things impulsively. You know me, right? I'll take time, I'll absorb things, and then I will work on them and create an action plan. So pioneer notes in some shape and form will be provided to you in a month. Today is 15 July. By 15 August, I promise you some summary would be there to take to the examination. Then every week, the power sessions that we have been doing from the last 1 year, we have only been doing the latest recent topics. Have we or have we not? Implant series that we did, internal bleaching, Australian endodontic guidelines, all 2024 latest release articles and guidelines. Now I'm bringing you the sleep medicine and the sleep apnea series in few weeks now. I'm going to bring you the calcium silicate and indications of RCT in traumatic injuries, what changes are there, which will be applied directly to exam, and at least 7-8 injury questions come just in pedo, and then in operative section, how to restore them, combined in multiple disciplines. So in young teeth and in mature teeth, in primary teeth, all kinds of injuries get asked. So there are about 7-8 questions there. It's a discipline on its own, the traumatic injuries. So there are recent indications of RCD in traumatic injuries, calcium silicate use. I'm going to have 2 separate classes on them. I'll put up a poll. You select when you want to do which. And then the sleep medicine series that I'm going to bring. There are 9 articles in sleep medicine, all latest Australian Dental Journal, which I am working on, summarizing them, combining them, so you don't have to go through those 9 articles, and I give you the crux of them, teach you the concepts, give you the pioneer notes on them or hot notes on them, and you consume, learn, assimilate, and then translate that to success in the exam. Yes, Preeti, as you have done my VPT document, right? And you have done my class, how I've explained that VPT document. 20 questions at least for the examination you have consumed and prepared for with that one sheet I prepared for you. And that takes years to fine tune and bring it. So your hot notes, all the latest ADJ, ADA policies, everything, and then your practice questions on Facebook group as well as WhatsApp group for all the latest topics will go on hand in hand, and that's your recent topic preparation. Hot notes are getting updated regularly. UAF Volume 2 power notes are coming. All the weekly power sessions, I'm covering new guidelines, new topics, new articles. So that's your recent topic preparation with me, and your core preparation goes on with your weekly study plan on the app. So Gifty, keep doing your week one, day one plan as you join the March course. You have been, told and informed to start with week one, day one, and continue. So whatever is week one to the week 22 plan is your core preparation. Along with that, when you study with the live classes, your Tuesdays and Thursday classes with me, your power sessions with me, your internal classes with me, you are doing simultaneously the recent preparation with me. And when you prepare hot notes, and when you're self-studying with the power notes, hot notes, and when you're taking mocks, assessment quizzes on the app, that's when you're mastering this beautiful, this should make you so happy. This is such an holistic way, not just to crack this exam, but to become the best dentist that you potentially can be. So that was it from my side with this complete hybrid approach. You're absolutely fully already covered. We don't have to do anything new because we have been doing all this while. So trust me, while other people are catching up, we were there working to prove our mettle. We were working behind the scenes silently to get our validation from the answer keys, our validations with the teams, our validation that yes, we are already working on the recent topics. Yes, we have already covered them in our classes. Not enrolled with me, all the power sessions, they are available on my YouTube and my Facebook. You can go and watch them, all the series that I've done with the latest topics. So this is a hybrid model that you have already been working on, and Gifty, you've started now. So focus on the weekly plan. This already includes both core preparation and the recent topic preparation every week. So within this batch also, I was just calculating on my calendars. So we have, say about, six internal classes to go yet. Ultimate Advanced File Volume 2, we have done 5 yet. So we are still needing 1, 2, 3, 4, 5, 6, 7. 7 more Ultimate Advanced File internal classes where we will wrap up the entire Ultimate Advanced File Volume 2, including the new sample paper questions. I'll need 7 files, 7 classes on that. And then power sessions till exam, we have about 9 to 10 power sessions still pending. So we have 9 internal roughly and 9 power sessions to focus on, to work on. And I'm planning, you already know the calcium silicate, the indications of RCT in traumatic injuries, and your sleep apnea, 9 combined articles in the latest sleep bruxism, latest sleep medicine, in pediatric, in perio. Every relationship that sleep medicine has will be covered in that series. And then these are the 3 that I can think of from my head, top of my head now. But as we prepare more internal classes on Ultimate Advanced File Volume 2, more patterns will emerge, more trends will emerge. And when I analyze the new 70 policies, of course, it will give me more ideas for newer power sessions as well. So just know that I'm constantly working. I'm a nerd. So be happy. You've got a very, very nerdy professor and a lecturer or a teacher or a tutor, whatever you may call. But I'm a very, very, very nerdy soul. I love doing my research. I love looking at the materials, and it gives me a kick. Preparing, studying for you, and then teaching and making it simpler for you. So leave it to me when I chew on 20 articles to make 1 hour session for you. Summarize that in 20 months. See, Arushi, you can hope, but what you can do more than that is work hard towards it. And that's what we are doing every single day. Hope should definitely be there, but confidence, of course, is number one. Have faith in your preparation. Have faith that you're on the right path. The trust and the faith, that's the most important ingredient, I'd say, for any success in anything that you do in life. If you're not doing it with trust and faith, if you're not having faith, if you're not trusting it, it you're more likely to lose them. But it's the hope and it's the trust and the faith and then working hard combined together will translate to success. It absolutely will, right? So luck also will favor those who are working consistently, they are persistent, who show up every single day without panic, without confusions, without doubts, but rather keenness to learn, keenness for clarity. All right, so I'll increase the time then, Preeti. You want me to increase the time for the ICG mock? Make it 2 hours? Oh, all right, we'll do that. Just drop me a message on WhatsApp personally and I'll ask Apurva to do that for you. All right, so any more questions, guys? Just put it on the chat because as I can see, I think most of your questions got addressed. Most of your confusions and doubts got clarified. What we have already been doing, what we will do with the Ultimate Advanced File classes, what we will do with our power sessions, what we are going to do in the next 6 weeks, the latest policies, the latest classes, the latest pioneer notes, every single plan I've already told you. So you know for 6 weeks, March candidates know for the next 6 months. Everybody knows what I'm on. Thank you, Charmy. Yes, I am a good planner. Thank you for that. So, but I take my time. I chew on ideas. I chew on things. I sleep on things. Then I wake up and suddenly I'm like with ideas overflowing. And then I have to, define them, work around in a plan. But it mostly works. Advice for next September exam candidates, Imad, you're talking about the September 26th? Thank you, Devanshi. You're too kind. See, Prajani, that's a practice. It's not that I don't panic. You should see me when I get all the ideas and when I'm talking to my team, I'm not very, very calm. But yes, whenever there's a storm, I try to tie everything down. And then it's like as a mom, if you think as a mom, there's a lot of things lying around the house. It's a messy house. Kids are not eating, their meals to prep and everything. You're panicking, there's chaos. But then you have to show up and you can't yell and shout, right, on your kids. So you have to be in that composure, with that poise. You have to come and with your kids, no matter what's going wrong in your life, with your kids, you'll always be patient and not show your chaos, right? So I think that's my strategy with you. No matter how I handle internal chaos, I'll never, never bring that chaos to you. I have to protect you from all the chaos. I have been doing it since the ADC canceled the COVID time exam. There was chaos. I was like, okay, let's handle it how I handle kids at home. Let's not let them panic. I do not like to enjoy the panic. I do not like to radiate panic. I do not like to take opportunity from panic and encash it. No. Everything can be controlled. Worrying seems like it's a necessity, but it really solves no purpose. Take that note, please. If there has to be one end note, worrying seems like a necessity, but actually has no purpose, cannot do anything. So whenever you're worried about your exam, just remind yourself, it looks it necessary. Oh, I'm taking this exam. It's huge. I have to be worried. No. Yes, Charmy, I've noticed that, and you don't have to correct it. So it is not necessary. It has no purpose. It will not take you anywhere. Leave all your worries to me and let me process it, alchemize it, and bring you the most planned, organized method of handling things. What to cover to read other than hot notes, policies, guidelines? Oh, that covers everything, Preeti. Do not worry at all. Thank you, Sneha. Thank you, Prajani. Thank you, everybody. Daniela, how you suggest to memorize doses and specific things? We are doing a lot of that practice, Daniela, in the TG classes with ACUS also. right? Weekly classes, hot note classes with tutors as well. It is a practice thing, Daniela, but if you have a partner at home or any other family member, please be paying for them, give them your notes, and ask them to ask you the doses. That's how you work best with your TG doses, medication doses. Practice with family, make them ask you again and again and again. Thank you so much, Hannah. I would love to be that, or I'll just be my own, thing, new thing. But yeah, thank you. I'll try to. So that's what I'm saying. It's not that it's all calm, but there's no chaos at all. I'm a human too, right? But absolutely, dentist studies, if you have seen my motivation class, I don't know whether you're enrolled or not. I don't see your first name here, but if you are enrolled with the program, there's a motivational class. If you're enrolled, and I do have some meditation classes as well. In what session was that? I think in 2022 or something. No, not 2022, actually 2019. I did the meditation lecture with my batch. There was just because there were COVID, right? The 2019 COVID came, I think 2020, yeah, 2020, yes, not 2019, 2020. When the COVID came, everybody was panicking. We had a group meditation session. It was so stressful, yes. And we had this big, like a collective meditation session. Together, we meditated for like 30 minutes or something, and it was game changing. It was a game changer. I combined two batches together because one of the batch got cancelled. We combined those two batches, and then they all took the exam together. The best passing rates, same Charmi. I had to take classes, losing my grandparents. 5 days after losing my grandparents, I had to show up for classes. I've cried, broken down during my lectures. So it was the worst and worst time. I don't pray that time upon anyone, but we all as collective went through that. So I think what we learned also was that how human we are and how fragile life is, right? In support class are also, so I teach the meditation methods also, yes. See, calmness you'll only achieve with meditation. You have to ground. You have to let the storm settle down. You cannot let it overtake you. You cannot. It will otherwise just blow you off. If you want stability in your life, you have to ground yourself. You have to remind yourself worries and thoughts and everything, all those excessive worrying, it may look it's important, but it is not. And it has zero purpose. All it does to you is take you down. But when you're grounded, when you just calm down, when you just let everything settle and focus and slow down, then you start seeing things with clarity. Let me do all that meditation for you and bring out these organized plans and this beautiful hybrid approach that we are already working on. You don't worry about meditating, leave that to me. You have fun, you work on your hot notes, you work on your power notes, you enjoy your mocks, put up some music there. I've given you some music ideas as well. Have fun when you learn, enjoy time with your family. Everything is under control. Okay? Thank you so much, Angie. And no, I'll not let you get broken. I will never, never let you be broken. Music ideas, Daniela, it's on some class. You go to the Remarkable website. If you've used the Remarkable tab, there's a Remarkable website. On that, they have music rooms. I really like those rooms. At that time, I gave that suggestion to my students now, but YouTube now has so much great music ideas. You can do 432 hertz music. Actually, if you really want to ground, 432 hertz music, you just search on YouTube, find something that resonates with you, but it has to be the 432 hertz vibration. Yeah. So if you can do the 432 hertz music while you're studying, it helps great deals. All right. Thank you so much, guys. Thank you for being the fabulous, wonderful audience that you always are. So, Raman, yeah, today's class was not academic. And next class, but this week's academic class, we are not putting it and moving it aside because we have so many new articles to do. So we are meeting on Saturday actually for our public session. Okay. I will put up a poll, we'll put up the topics there. You choose, you decide, and I will conduct it. Okay. Thank you so much, guys. Have a wonderful, wonderful, wonderful week. And if you want this presentation to be uploaded on the app or on the drive, let me know. If you want to see it again to feel calm, the approach and everything, I'll put it up there. Thursday, yes, our internal class. Yes, yes, yes. Nivedita, that goes without saying. Thursday, yes. Thursday, absolutely our Ultimate Advanced File Volume 2 class. Saturday is the extra class with me because today was supposed to be an academic class, but we did it, we covered this. So then Saturday, I'm going to be doing the academic. Okay? By Thursday, I'll put up the poll. Thank you, Saida. Pleasure is all mine. The love is all mine. And I'll see you on Thursday then. And then I'll see you on Saturday. And then I'll see you next Tuesday. Thank you. And meanwhile, you'll also see Dr. Ansh on Sunday. Then Monday, you'll see Dr. Akers. So a lot of preparation and revisions and everything, meeting, learning together. So everything is right, okay? Everything is going the way it's supposed to. You're on the right path. You are ahead of the curve as always. Thank you so much. Have a fabulous, fabulous, fabulous night. Sleep, relax now. Do not overthink, please. Thank you, Sajida. Thank you, Mega, Kirtana, everybody. Thank you so much. I'll sign off now and I'll see you on Thursday. Thank you, everybody. Thank you. Signing off now. Bye.